regarding the importance of nutrition. The purpose of the food is to increase the duration of life, treating patients of cancer only by changing the diet. I'll begin my talk quote by Dr. Hippocrates, which was said almost 2500 years ago. He said that let thy food be thy medicine and medicine be thy food. What exactly does he meant? Did he meant? Which was, this was way ahead of time, that 2500 years ago he understood something regarding the importance of nutrition. He said that the food can be medicine. If given in correct amount, food can have healing powers. And if it is given in a right proportion, there is no need of medicine. He even went further to say that you can put the medicines in the pot of a chemist and give food to the patient. This is the importance of food that we should know. Okay, I'll now introduce myself, what I am. Actually, I am Dr. Minal Surve. I have been practicing as a homeopath basically for almost 11 years. And I always had this in mind that, I'm treating patients, a lot of patients. I give homeopathic medicines, and still some patients, they have this obstacles to cure. We have in our aphorism, which says that you should also treat the patient in a holistic manner. In the sense, not giving only medicine is not what is required. We should also correct the diet of the patient, give proper exercise to him, whatever is the lifestyle modifications are required, that also is necessary. So this you can see in Organon of Medicine, which was written by Dr. Samuel Hahnemann, who is a father of homeopathy. He says in aphorism 4 that he is likewise a preserver of health if he knows the things that derange health and cause disease, and how to remove them from persons in health. What exactly does he mean when he says that how to remove them in persons in health? What does that mean? That means if we can give food in a correct way, a patient can be prevented from becoming a patient. So, in the sense, you can prevent diseases with the help of proper diet and nutrition. That's what he meant to say in this. Also, there is a reference in Bhagavad. See, when I was a child, I had read Bhagavad Gita and seen. I couldn't understand that much, but I had seen a picture where it was shown that some non-vegetarian food is there, and there is some darkness, and there is some light fruits, fresh fruits and vegetables, and there was a bright light there. This picture I had in mind, and I always thought ki, is food that much important? While I was preparing for this, and then I thought of going back to Bhagavad Gita, and there also I came across a quote which says that the purpose of the food is to increase the duration of life, purify the mind and aid bodily strength. This is his only purpose. So I was like literally struck, like it just struck me that how important is food. Patient आके पूछते हैं, that क्या खाऊं मैं, क्या नहीं खाऊं. There was a case, interesting case, where I have been treating this patient. I took her detailed case. She was a lady, girl of around 17-18 years old, and took her detailed case, and she had hair fall and acne and dandruff and some similar complaints. And then I realized when I took the detailed history that she lacked her proper balanced diet. She was not eating properly because she was traveling to the college, and at an odd time. The college timings were very odd, and then she was not carrying her tiffin. If she carried the tiffin, she wouldn't. The break was very small, so she couldn't finish the tiffin on time. So after the case was over, she asked me, what is the cause exactly? Why am I suffering? She's like, I said, you do not need medicines, you just need a balanced diet. She had come for homeopathic treatment. She was expecting that I'll give her some drugs, but of course I gave her. But then the main cause was her diet, She was not eating properly. So I advised her. That time I had not learned nutrition, but yet I knew the importance of nutrition. So after all these instances, like one is Bhagavad Gita, one aphorism of Organon, all this I had in mind. And then just 2-3 years back, I met Dr. S. Kumar. Okay, he is a PhD in nutrition. He's not a doctor, but he studied nutrition in great detail. He's done his PhD, and I was sort of assisting him in his clinic, and I was very surprised that there were patients, he was treating patients of cancer with only by changing the diet. And I was like, I have been already practicing for almost 6-7 years or more than that at that time, and I was like, what am I doing all these years? I mean, if he can just change the food and treat the patient, then I mean, if I can give homeopathy as well as nutrition, my patients are going to heal much faster. Okay, so then I thought of pursuing clinical medicine. I have done a certification course from American College of Sports Medicine in clinical medicine as well as sports medicine. And then I thought that no, I should. This is what should be done. You know, only treating a patient with medicine is not enough. I think all this is important. So then after I studied, I almost studied for 1 and a half years, and then I realized there are some common factors between homeopathy and nutritional science. So first is both the sciences are very gentle in action. They don't have side effects. Second is both are close to nature. Like homeopathy is much close to nature's law of cure. Similarly, food, if given in a proper way, is much close to nature. There's no chemicals or anything, and no side effects. Then in both the nutrition as well as homeopathy, we do a lot of individualization. In the sense, not in all diseases, like so if a person is suffering from, let's say, acne, then not all, if 10 persons are suffering from acne, not same medicine is given in homeopathy. Each of the 10 persons would be individualized, will know the details of will know his mind, his body, how it reacts, and accordingly will prescribe homeopathic medicine. Similarly, in nutrition, we will see the patient's proper lifestyle. What is he eating, which further I'll come in details about what is carbohydrate, proteins and fat. Okay, so I'll just see that. So I mean, both the things require a lot of detailed case taking. It's not so when I see patients asking me, you know, can I follow a DASH diet, etc., XYZ diets from, you know, Google that they come and think. So it is not going to act, because it has to be individualized. Like every person is different, every body is different, so the diet would be individualized accordingly. Okay, so coming to my main topic, nutrition. So nutrition is a science of food and its relationship to health. Okay, so what is food exactly? Food is something which gives us energy, and that's the only thing, you know. When we whatever functions that are happening in our body, we require food. Food is converted into energy in form of ATP, and then the work is done. So for example, we think that, you know, for only when we are running or only when we are cycling we require food and the energy. That's not the thing. We require food and the energy only for involuntary actions like respiration, circulation. Whatever is happening is a lot of, it's a big chemical factory inside us, and there's a lot of processes that are happening. So every involuntary action requires energy, which is in the form of ATP, which comes from food. Okay, and all the metabolic functions. Then we require energy for walking, even when we are watching TV. For example, you think that you don't require energy, we require energy. So all that is requires ATP energy, which is converted from food. So now I come to how do we prepare food exactly. So when we start preparing food, first of all, for food, cleanliness is very important. So when we start, the kitchen should be very clean. All the utensils should be very clean. The vegetables that we cut, how do we cut it? So I have seen a lot of people cutting vegetables in very minutely. So what happens is all the B vitamins which are water soluble get lost when we are washing it. So it is recommended that you wash the vegetables first and then cut it. instead of cutting the vegetables and then washing it. So that the vitamin B is retained in the food. Then second is how when we eat the food, how do we eat it? In the sense, हम लोग अगर if you're watching the food with the mobile, nowadays we see a lot of people having mobile is a continuous thing that is there with us. It's like 24 hours antenna that is always there. So when we are eating, there should be, first rule is there should be no mobile, no TV. So what we are eating should be like mindfulness. We should concentrate on what we are eating, then only the body will absorb most of the nutrients from it. Then people ask me what salt should be used. So the salt that should be used is use sendav namak instead. Sendav namak is a pink rock salt. It comes in a form of rock, or it also comes in a form of crushed powder. Why I say that? Because it has all the minerals and vitamins that are required in form of nature. And instead of when we eat processed salt, there are more chances of people getting hypertension, and a lot of problems can occur because of that. Then second is oil. So which oil should be used? So I tell people that you should use oil which is specific to your region. So if for example the person is from South India, they will mostly use coconut oil. So you can use coconut oil. And then people from North India, whichever oil is specific to your region, consume that. So jaisa north mein we see kachi dani, people using kachi dani, and even rice bran is very good, so you can use rice bran because it has omega 3 and omega 6 in a good proportion. So these oils can be used. Then sugar. The sugar is a very big thing. We should avoid sugar, and you can use jaggery and honey instead of sugar. So these are the few things. Then include a lot of fresh fruits and vegetables in your diet. Fresh fruits and vegetables, because they have a lot of beta carotene, and there is fiber in it. Diseases start because of the oxidative stress that takes place. So these fruits and vegetables have antioxidant properties. So you can avoid a lot of diseases in further if you are eating a proper healthy fresh fruits and vegetables. Now how do we classify food? What is a balanced diet? Okay, so first of all, food is divided into three constituents major: carbohydrates, proteins and fats. So how much carbohydrate is required is almost Indians are a population which consume carbohydrate in a much more quantity than any other countries. So we in India we almost consume 60 to 70% of our carbohydrates is there in the diet. So what are carbohydrates? Carbohydrates come from the fruits and vegetables. All these are carbohydrates. Then what is then protein? Protein is your dals and your non-veg sources, that is your chicken, your fish, eggs, all this is protein. Then third is fat. So fat comes in form of oil and your ghee. How do we assess that the diet is sufficient in protein? So whatever in all these three, what is lacking is protein. Protein is very much lacking in our Indian diet, because even if people who are non-vegetarians, they consume non-veg almost 2 or 3 times in a week. Okay, and our daily requirement of protein is 1 gram per kg body weight. That is, if a person is weighing 60 kg, he should consume 60 grams of protein. And a normal egg contains almost 7 to 8 grams of protein. So how many eggs do we have to consume every day to fulfill our requirement of 60 grams of protein? Protein is really important, because it is required for our muscle development, our brain development. A lot of things are dependent on protein. So consume protein in our diet. To conclude, I would say that there are 4 R's. First is you should respect your body. what is respecting your body? I mean, you should love your body. That means that whatever you're eating, if you think that this doesn't suit me, or it doesn't, it is going to give harmful effects to your body, then you should avoid it. So that is first R. Second is refuel. What is refuel? The fuel that food is a fuel, food is the energy. That is whatever we are eating is a fuel. So you should understand the signs of your body, and whenever you feel hungry, you should not leave that hunger, you should eat it at that time. And refuel your sources so that you can carry on your daily activities without any exhaustion or without any weakness or anything like that. Then third R is rehydrate. Okay, so rehydrate is that means you have to hydrate yourself sufficiently. Water, I mean, I have come across many patients in so many years of my practice that a simple thing like water, a lot of people are not drinking water, enough drinking water. So to just give you an example, if a 70 kg person is a male, there will be almost 40 kg of water. So that much we are sort of 60 to 70% is water. So if we do not drink sufficient water, there is a lot of things. It is a basic thing, but people don't drink it. How do we know that water is less in your body? So the best and the simple thing is you check the color of your urine. If your color of your urine is slightly yellowish, that means you are drinking less water. So ideally the urine color should be pale yellow or white, towards white. So you should understand your signs of your body yourself and try to see. Water intake will be changing according to the climate, according to the inside, if you are in the AC room, your requirement of the water will be different. If you are in the sun, your requirement of the water will be different. So you have to understand and try to learn how your body reacts and what you are going to try to understand or read your body. So that would be a better sign to understand what to eat and what to drink. Then the fourth is recovery of your body. That means rest of the body. Sleep is a very important this thing. People, I have seen a lot of now. If you see corporate life, many people are not having proper sleep, or even if they have sleep, they will it will be very disturbed because there is a lot of stress in life. So I have seen people who are having 4 to 5 hours of sleep for many days altogether, and they are not understanding the importance of sound 7 to 8 hours sleep. So that is very important. To conclude, what I will say is, if medicines only were sufficient for our body to heal, then I think there would be no restrictions. The doctors would never restrict salt for a hypertension patient and sugar for a diabetes patient. Thank you.